not just AI. If you look at the technologies, even simple technologies like electronic medical records or digital health systems, you find that those who are taught before this came into place
Yes.
have a harder time integrating it in their day-to-day work. So they will say that as you introduce new technologies, they will say we were not taught that way. And, medical space is very highly regulated. So I think it will work so well if we start integrating AI in our teaching, in our med school, so that when now they come to the workspace,
Yes.
they will have already adapted and will be able to integrate it very well in the workplace. So I think this is time to bring it to our med schools in the curriculum, as we review the curriculum, to see this as a tool for the future of healthcare that can't be ignored.
Yes.
So I 100% agree. I think AI will also help medical students. Even currently while they're in school, there's so much research AI can help you with, right?
Correct.
Makes your life easier. You can look at new trends. You can use, there's one thing we call natural language processing in AI. We are able to ask, the way I'm conversing with you, you can converse.
You can literally converse with AI.
If you've tried ChatGPT, you'll be able to see that. So imagine now applying these kind of NLP technologies in your research, in as you continue in your school, in your college. And also there's also things like chatbots that are AI enabled, that in future you also don't need to the patient, there will be an AI interface between the patient and the doctor. So the patient is first of all conversing with this chatbot, which is drawing from a bigger what we call a corpus of corpus of information, like an entire library of information that a human being can't contain. By using AI chatbot, you're able to access that.
To access it, yes.
So that's another way that we can bring AI in there. I feel like we are going to a place where each of us will have an AI health assistant. The same way you have your Google map when you're driving around town to help you navigate.
I can imagine how that's going to be interesting.
Yeah, this will be a tool that helps you navigate your healthcare. You wake up and you say, today I feel like I'm having back pain and joint pain and this and this. And the AI will be able to look back historically what has been happening in your life and recommend, should you actually go to a doctor?
Okay, yes.
Should you just go to a pharmacy?
Yes.
Or should you? So this is going to be so integral in our lives a few years from now, especially when it comes to healthcare.
Exactly.
AI will become a true companion for your healthcare.
That's true. Yeah. That's true. I'm also seeing that. And of course that comes with a lot of skepticism.
Yes.
That definitely comes with a lot of doubts. People are like, no, this is technology, guys. Yeah. And we've had a lot of stuff about technology. I mean, we have social media, there's the good, the bad. The people say it's the bad overshadows the good. Where are we, in terms of the medical facilities in integrating with this? And what are some of the major challenges AI, happens? I mean, given what you just said, it looks like it's going to be very easy to actually even run a hospital, all right? Even the Ministry of Health is going to feel like it's very easy to run some of this stuff. So do we have any challenges so far, despite the beautiful picture you've painted of this AI in health systems?
Yeah, challenges are bound to come. I think this is the time to start now regulating, in thinking about how will we regulate AI for health, right? And without stifling it too much that people are not able to innovate. I think we need to come up with an AI regulation that works, allows innovators to come up with innovative things, at the same time protects the patient. I think we have to balance that, and regulation comes in handy. Tomorrow morning at Marsabit Plaza, there's a national AI strategy focusing on healthcare, being hosted by an institution called Kala, where we'll be discussing some of these things. How do we come up with a national AI strategy that allows us? Because what happened is other countries went too quick to regulate AI, and that's like tying your hands behind your back. So we are saying, before we regulate, let's think through what will our national AI strategy look like, and then start now integrating regulation. Kenya and under the leadership of the president is putting healthcare the right and right to left and center, because there's now an initiative they're calling the digital superhighway, where every facility in Kenya will have to be connected to this digital superhighway. That means all records, be it private, public, faith-based, from level 2 upwards, all of them will now have to report their data electronically into this digital superhighway. Which is going to help us in terms of two things. One is, for you to build AI, you need data. Right? You can't have data if some of the data is not digitized or is offline. So forcing people to, or putting a regulation that allows people to, everyone to report this or port this data into this platform, will now create the data that we need to build AI engines. So once we do that, then we'll start seeing now, like in any situation, you have to keep weighing pros and cons and setting some guardrails where patient data, for example, needs to be protected. Like you as Muli, you don't want to learn later on that I, as an AI developer, accessed your private data. You access
my private,
So
it's very vital information.
Those are kind of regulations that we need. So a balance has to exist.